Yeah, usually we know once the symptoms begin to show up. And Dr. Isabella Wentz, who's a pharmacist and has written a great book called Hashimoto's Protocol. It's probably the best-selling book in the world on Hashimoto's. She describes 5 different stages of Hashimoto's, and it's not until the 3rd stage that we really begin to see it. And so a person will have constipation, they'll have a slow heart rate, maybe easy weight gain, fatigue, depression, anxiety, dry skin, dry hair. The hair is beginning to fall out. We begin to see everything kind of slowing down. And so we look for those symptoms as we're beginning to test for Hashimoto's.
I see. And those symptoms are also common for perimenopause and menopause, right, as well?
Absolutely, yeah. So it's one of the differentials, or one thing we're looking for among many when ruling things in and out.
I see. So let's talk a little bit about the treatments. So, as a naturopathic physician, you're obviously using naturopathic medicine and treatments. What is the overall protocol that you use?
Yeah, so I don't operate by a protocol myself. Each person is unique. I use something called the doctrine of individuality. Everyone is going to get a little different plan, a little different treatment, depending on the root causes that are leading to their Hashimoto's, thyroiditis. And basically, I'm going to use a similar approach, though, with everyone. And I'm just going to grab my book here, The Serpent and the Butterfly, The 7 Laws of Healing. In it, I have a triangle of chronic disease. And basically, it shows that there are 3 legs to the stool of disease. We're looking for toxicity, we're looking for deficiency, and then we're also looking at energy and mitochondrial energy to decide, how much energy does this person have? What's the vitality, and how can we get that vitality increased? So basically, I'm looking at a person. How are they deficient? Where are they deficient? How are they toxic? Where are they toxic? And how can we, what's their vitality, and how can we help to enhance it so that the body can begin to heal itself? And if we can do those 3 things, and there's so many ways to do that, so many therapies, so many modalities, so many supplements and approaches, but as long as we're moving in that direction with the person, generally their Hashimoto's will begin to improve and hopefully resolve.
Fascinating. Yeah, I know. I've seen your book, and I've read not the whole thing, but I've read quite a bit. It's absolutely fascinating read. Talk to us a little bit about the testing part. Do you do some kind of a specific testing to understand, what's happening in, like you said, a personalization, right?
Yeah, so with Hashimoto's, we're doing a full thyroid panel, and then we're checking for antibodies, particularly TPO and TG. We also might do an anti-TSI, which is a thyroid stimulating hormone antibody. It's less common, but we'll test that as well. And then we're basically looking at the thyroid and then running all the other routine labs. As far as that'll tell us the degree of Hashimoto's generally. And then we couple that with the clinical presentation, because the clinical picture is more important than the blood work generally. I treat people, I don't treat labs. So I treat people with the labs, not just the labs. And so that's the basics. But then the specialty, we can do complete hormone testing. We can do hair mineral analysis, looking at the hair for metal toxicity. We can do a complete stool analysis, looking in the gut to look at the microbiome, looking for yeast and fungus and bacteria.